Hi, and welcome to our SOAP virtual online event featuring the esteemed Matthew Erwin. He is our guest speaker today on the health and well-being of the professionals who are on the front lines of medicine in the midst of the pandemic. Matthew has special expertise to share with us today. He has a background in computer science, math, and engineering, which was honed at Georgia Tech and Georgia State, where he won numerous awards with honors and was recognized with academic distinction. Soonly thereafter, he was entrepreneur of great rising recognition in 2017 by Tech Headlines, and then also recognized as an inventor of the most innovative computer networking platform in 2019 by Acquisition International. On this journey, had helped to found a consultancy firm called SnapTech, which was initially engineering systems for digital ad and payment processing firms, some very renowned ones on the NASDAQ, and then went on to found his current company, where he is currently CEO of MindTrend, a startup that's focused on education and enhancing digital credibility while addressing challenges of news, which is otherwise misinformation. And that's never been more relevant than it's become today, in the midst of lots of different messages in which patients and healthcare providers alike have been confused and sometimes uncertain about what to do and whom to believe and how accordingly to act. So I'll stop talking and please welcome Matthew Erwin. And Matt, take it away.
Well, thanks for having me, Trevor. First of all, I really appreciate that you've taken the time to talk with me and also share with me some of the concerns that you have and you've seen in this quarantine, the crisis that we're currently in globally, that's hitting a lot of different fronts. And I think this is a great opportunity to be talking about another aspect of that, which is what's it like in the space of the healthcare community? What's it like to deal with well-being in the crisis with the people who normally we go to for our well-being? And so, first of all, thank you for the extensive intro and just the privilege of being able to be here and to speak with the community that's on the front lines and addressing this. Our first responders, so to speak, in the emergency rooms and so forth. I just want to express a tremendous amount of gratitude that I have to have such a privilege to speak at all today. So thank you for that, Trevor.
Yeah, it's our pleasure. And Matthew, when you founded your company or when you had ideas about the way in which we provide digital credibility, can you define that and help me understand how, a physician or anyone who's in a position of authority that's trying to impart a message, how is it that we go about trying to do that more effectively?
I think ascertaining credibility is a significant challenge. We talk about it and we hear about it today commonly as fake news, but it's not really that. The idea of something being purposefully fake or deliberately fake is a threat, right? But also we have this extensive issue wherein people don't know what the accuracy of information is at the time they're sharing it. You and I have spoken briefly previously about what does it look like for research that comes out that's going through FDA trials and the normal years-long continuum to understand that some underlying part of that has failed. That's not deliberate, that's not fake, it's not something that you would normally categorize as this, but that is actually what we're facing, right? We're facing an issue wherein how quickly we have access to credibility. Do we put it on the experts? Because we're dealing with that today, where we've had a loss, say, of credibility with the CDC on the response to this crisis, not deliberate, right? Again, there's some missteps that happen, but there's very, very low tolerance for that in a world in which people are quickly able to get access to information and they're either following it right away, right? It's like wash your hands, 20 seconds, do this whole thing, sing happy birthday. These are great things, but there's something important I want to visit with you on this aspect related to well-being, because having access to credibility makes a huge difference on whether or not we have access to well-being. If we talk to our doctor, we want to be able to believe what it is that they're saying. Should we try this medication? Are there real dangers involved there? Is it going to make a difference for the condition that I'm facing? This condition that we're all facing collectively today has kind of missed how much the impacts of that have on the community of healthcare professionals. So if you think about, people talking about a Great Depression or a repeat of that, really what they're talking about is what happens when you have panic, human panic. You have everyone make a run on the bank. The government stepped in and offered some assurances about that. They say, okay, we've got the FDIC. We are going to create some sort of influx of stimulus. We had all the FDR programs, which were to make a difference in restoring a sense of stability. And that's where traditional government stimulus has started to become sort of the Band-Aid anytime there's an issue, and they've been fairly effective with it with some new tools. Without getting into monetary policy about that, what I want to talk about a little bit today is what does it look like to have a run on healthcare, right? Because if we looked at the monetary situation, you get people in panics, they hoard, they don't spend their money, they're too scared to spend their money, they go run at the banks where the money is or is expected to be and try to withdraw all that. In this space that we're currently in, that's an issue we should probably consider about healthcare. If people have paid insurance for a period of time and they expect to be able to get access to healthcare, but they can't because of lockdowns, they can't because a physician who's an entrepreneur has his facility which can't open because it's outpatient services. It's not specific to COVID-19. What does it look like for people not to have access to that? What does it look like for a healthcare professional who works in a hospital to be dealing with hoarding? Not hoarding of money, but hoarding with personal protection equipment, PPE. We hear about, well, we're not going to have enough ventilators. There's a concern about that. As soon as you hear that, you're dealing with the same human psychology of, wow, there might not be enough. I'm thinking this is a scarce resource. This is a serious problem. I'm looking out for my people, right? If I'm a hospital administrator, but not only that, I might not even give it to some of my people because I'm concerned that, well, this isn't quite as bad as it's going to get, So you're dealing with all the aspects of what an individual might historically think, like, hey, if the government's like, they're there, everything's fine. And you have an administration, for example, that people would consider credible, which I think we have a lot of people that are dealing with that. This doesn't feel credible. What we're hearing is, should you inject something because it's a cleaner into your thing because a president might say that? It's like the crisis of credibility is far reaching and it's been accelerated by the internet, right? So I think it's very important for us to start by talking about the philosophy behind whatever the solution might be. What are the issues that cause this to come into play? I mean, if people study a depression, if they study monetary policy, they really want to see how did it come about and where could we maybe interject something into that space well in advance of when it gets to this point. Because right now we're at this point. We're at the point where people are timidly trying to look at reopening. Can we sustain a threshold of patients such that there's herd immunity? And so this opportunity to be here on this call, this video with you and discuss these, I think is really great. So I really wanted to give you a chance to share with me a few of the things you're seeing, Trevor, and maybe we visit those in regards to what AI might be able to do, in regards to what tech may have made as advancements alongside of that. And also, before we get into that, I do want to say that the world of AI as a magic medicine, so to speak, is often overly hyped. There's a lot of things that are practically there. I think the first step in that is to visit the issues that are at hand in a particular field, in this case, healthcare, which is very private to many people. It's very highly regulated. And then look at what is the philosophy that governs such an apparatus. If you're introducing AI, you can't be black boxing it. It has to be peer reviewed. You want to be able to have an aspect of how do you bring value there that people see as credible, experience as credible, and can be adequately addressed when there's an issue. So Trevor, if you could share with me one or two things that you feel are really in front of you're part of the SEOPE, which is the Society of Physician Entrepreneurs. And I understand it's been around for quite some time. And as a fellow entrepreneur, I can imagine are dealing with many types of concerns on the front of finances, getting access to small business loans, and the issues of employees. What's happened in the market with everyone on lockdown? Is this something that physicians feel maybe they should visit some technology solutions for? And then we can dive in a little bit to that. What do you think?
Yeah, you covered a lot of ground there. Yeah, in terms of dealing with the psychology of human fear and how that spreads, I mean, I think that's something we're all reckoning with, and we continued kind of to work throughout the crisis because we took care of orthopedic trauma, and people didn't stop having fractures and other problems just because a virus was around. Even though, obviously, especially my partners, were concerned, one, about whether they would infect themselves or infect their families or their coworkers. So that was, certainly a challenge for us. And thank goodness for the way some of the stimulus has worked out so that we've been able to keep everyone on and not let everyone go. That's one of the things I've probably been proudest of since this has gone around. And I think it's helped create a certain culture that there's some shared sacrifice going on between us and all the employees who've been able to stay on. Some people have worked from home, some are not able to, depending on their role. So, but it's interesting that you bring up AI in this context, because I think, when you speak about fear, I mean, there's already sort of this idea, or there is some type of psychological fear on the part of certain people with different roles throughout healthcare that I'm going to be replaced by a machine. And I think particularly now, people in administrative and oversight positions are saying, well, I don't want to put human lives potentially at risk. So now it's not just a question of streamlining and process automation, but in fact, there's implications about whether or not I'm putting somebody else at risk or putting them in harm's way, by asking them to participate in the midst of a pandemic. And for me, I agree. I think physicians in general, we probably don't understand a lot about artificial intelligence. And sometimes we're told that it's being used or machine learning is being used, and that may be misrepresented. And we don't always have maybe the background to know it. The first application I saw of it was the supercomputer event that they used to screen. I think it was, it was like an enormous number of molecules within several days, and then boil it down to, the report had like 72. And I remember looking at the top 5 of them and thinking, should we be using hydroxychloroquine for prophylaxis? Should we be taking this herb root called quercetin that was on there that was readily available at health stores? I think it was like number 5. So people were asking us for recommendations about how to keep themselves safe. But to your point, I think when you talk about artificial intelligence and the way in which it could augment the way that we understand how to disseminate information, that's what I'd like to hear you talk more about, because I can think of moments when my wife, who works as a hospitalist, said, I'm looking for updates from my ICU physician. I'm wanting them to tell me, should I put this person on anticoagulation? Should I put them on prophylaxis? Should we give them these antiretrovirals? Should we not give them certain other medicines? When, how early do we need to be when we intubate people? And she was looking for updates that were mostly coming through either department meetings, which not everyone could be at, or emails. But the situation was very fluid and it was changing constantly. And so that, obviously creates, uncertainty on our behalf when we're trying to do whatever we can to help people with a disease we don't fully understand or fully have legitimate solutions or vaccines for. So could you expand a little bit on the role of using or harnessing the power of artificial intelligence, maybe to help disseminate, peer-reviewed or vetted literature on the part of people who are serving on the front lines?
Well, that's an interesting question, right? So messaging is an area that's traditionally been dominated by advertising, digital advertising as a thing. They know how to get messaging out, but that messaging oftentimes isn't, as you're saying, vetted or you can't be relying on it. I mean, there's kind of two problems here you're talking about. One is how do we get that messaging out in a way such that people can, if you talk about contact tracing and tracing a pandemic, for example, what's it look like to do some contact tracing around how information originated? And really, what would it look like to see that percolate out and through? I mean, this is something that I've spoken up before in regards to AI, is how could it look like? We talk about neural networks and things like that. They're obviously just analogies for how that might work, but ways for people to relate to it in a non-technical capacity. So if you're thinking about, well, what does it look like for something to be able to be vetted? Today, information goes out, and that information might be a link on the web, and you click to it. But there's no real way, if the underlying authors change their opinion about that, or the subject matter, that they became aware of something else, if underlying research falls and so forth. So the levels at which information gets digested and repeated, and the speed at which it happens when you're dealing with some sort of emergency is really accelerated. So when I think about messaging and I think about, well, what does it look like to augment? Because I think the word augment's really important. You use that to describe how AI might come in and step in as some sort of facilitative role for physicians. That's really important to understand. People oftentimes think, okay, AI, it's this intelligence, and somehow it's going to replace my role as a human being, or it's going to be competitive to me. People are worried about it as a process, that it adds efficiencies for business. Maybe for the owner, it's like, yeah, you're the entrepreneur, you're the CEO, you're the owner, and of course you want to make this as cost efficient as possible, but at what cost, And that's where people start getting into talking about basic income and so forth. But I think really there's another aspect to that, when we're talking about messaging, and messaging in AI has many of these same problems. People talk about stuff all the time. Sometimes it's hype, sometimes it's interesting because it looks promising, and then the follow through isn't there, but people continue to propagate what they hear. So they hear something and they're like, okay, well, I heard this, it was from a reputable source. It's not really categorized, it's not really connected in a way that's relational to the new material that someone else is sharing. So when we're talking about this, these aren't near-term immediate things to just say, hey, I'm going to go install an AI based backing platform, and I'm going to license this some way, and it's going to digest all this information that I have and somehow spit out these amazing things. It's not. People that are selling that it's just going to do that. They may have something that's promising. It may be a long-term investment, and it may produce those results in eventuality, but it's not going to necessarily do that right up front, and certainly not across any category. So this messaging thing's huge. I mean, credibility is the basis for anything that we have in our society, for believing that we have the checks and balances that keep our government stable and able to grow and prosper through these sorts of things. We talk about that right now in well-being because it's so intrinsically important to our well-being. If we are anxious all the time because we're starting to lose confidence in the measures that are being applied, and that we deal with a circumstance wherein there's potential for malpractice, these are all based in what do we find as a way to convey a philosophy that builds credibility, that really speaks to whether or not someone is in fact an expert on anything. What's that community look like? What does it mean for that person to be vetted? What does it mean for that person to be trusted? And would you know it if they shifted at some point? Because once an expert does not equal always an expert. If I come in and I talk about something, it's like, okay, well, maybe that was true at a certain point. Maybe it was applicable to a certain field, and now it's been conveyed as this huge other thing. So when you're speaking about messaging, I think the basis of that is, how do you make it credible? And the structure that I would lean towards in that space is to have that information connected in a way such that you get machines to assist you in verification. If you get a notification because someone liked a photo that you posted 6 months ago, that comes front and center, right? And you can see something related to behavior that you engaged in some period of time ago, and it's connected. And that's a rudimentary case, But imagine that in the same way, if you're going and consuming information online, and that information is relationally connected. So we're talking about not necessarily the intelligence that's added on top of that, because the intelligence added on top of it is how do you filter it down to be relevant context. But before you get to the question of relevance is how do you structure information in such a way that it has traceability? How do you say, all right, if someone is indeed vetting this, do they have access to what it takes to vet it? Or are they just part of a community that's just like started to oh, I just checked it because I always rely on that. I've got one of the best nurses here who does that. So I don't really, you get lazy at your job. You know what I'm saying?
Yeah, certainly. Do you think, overall, you think tech is making the situation better or is harming the sort of the post-pandemic stress disorder we're going through?
Oh, man. I mean, that's a great question. Is tech harming? Tech certainly has the capacity to harm. You could say that the internet has harmed different things. People are concerned that it's harming democracy. They're concerned that it's harming our ability to factually know anything. People start to see something and they gravitate towards it, and at that point they're not really sure. It's like, well, was somebody being deceiving about this? Is there a conspiracy? People start really getting in their heads about it.
Yeah.
And tech has given people access to just a plethora of information they wouldn't normally have. A lot of people are given voices that normally wouldn't have one. Talk about somebody who's a YouTuber just because they play a game and they're being authentic, and the authenticity itself sells, right? Reality TV is kind of in that space. So you have a mixed bag. You can't unroll tech, right? And tech has offered many, many wonderful things, but it has to be guided by a philosophy. And that philosophy, I mean, in medicine, you have the Hippocratic Oath. It's like there's something underlying that should be your compass for saying, when did we get too off balance? And I think we're starting to see that in tech significantly, because tech's kind of been a scapegoat some of the time, an excuse for something going wrong. Oh, it was because of a security flaw as opposed to poor human practices, or bad business. People that are engaged in business they shouldn't have. A lot of the stuff that led to the underlying crisis that we had in 2008. These are interesting things. I wouldn't state either way that I would say tech is good or bad. I don't think of tech as a thing, as an entity that has a morality around it. It is the people that have access to it and how they're choosing to use it. So if you have a problem and all of a sudden you want to say, well, tech is harming, take a deeper look. There's somebody behind that. There's a society behind that. There's something else that would be utilizing that as a tool. It's an age-old struggle of humanity.
Yeah. I think it's a tool and it can be used well and not well. And, one of the things that we're questioning, like medicine is now forever changed, right? Like we're never going to practice it exactly the same way that we did before this. And I think, Arlen Myers, who's the national chapter president, has kind of gone to say that, when you're trying to figure out how to resuscitate medical practice post-pandemic, you got to look at your space and your stuff and your staff in terms of, ways that you use costs and overhead and tools that are available to you. One of the things that I guess I feel most grateful for is we were already kind of working on a digital orthopedic rehab platform. And so when a lot of people were all of a sudden not coming into brick and mortar physical therapy anymore, now all of a sudden we had this tool that really we were sort of going to pilot for a small subset of who was working with it. And then all of a sudden we actually started getting increased referrals that were coming in our practice. And it's not the same thing, obviously, as being able to, come in and have somebody examine you and manipulate you. But what it did do is it provided, a lot of continuity of care for people who otherwise, post-operatively or even in the absence of a surgery would have had no opportunity to convalesce and get better. And now they had an option to do so with real guidance, even if they weren't physically coming into the office. So I think, in that regard, we were so grateful to have tools like that, available to us. But I've also kind of felt that, all the Zoom meetings, I think we were going to do a chapter event here in person together, and, the social connection, I think, humans are meant to socially connect to a great degree, and it's part of our health and our well-being. And, um, I'm feeling the strain from it. I think, my wife and our family and lost opportunities to be with family have felt that as well. And, um, we'll see about how that goes for the way forward. But I think the idea about when social isolation is supposed to be done doesn't appear to have a real target end date yet, or at least if it does, it hasn't been disseminated well enough by vetted experts in a categorized fashion to make us confident about that going forward, despite the measures that we take to reduce risk any way that we can. So,
Right.
do you have? I mean, you do you, as a a founder of a company as a company whose mission is kind of education in the digital space. Do you find that people are coming to you and asking you for different questions or different proposals or different ideas about how to stay alive, like in the new kind of current business environment?
Absolutely. I mean, we're having regular Zoom sessions with a variety of business leaders in particular. I mean, this conversation that we're having right now is in that space of how do we discover a way through this and not come in posturing with a bunch of answers and try and put a hammer to everything that looks like a nail. I mean, um, congratulations on finding new avenues for serving people in your business. I think that's such a powerful thing to be able to adapt in an environment like this. Um, I would say that in tech or in healthcare, we have a certain luxury, which is that there's a demand for it that doesn't really go away. Because I mean, certainly if someone's sick, there may be fear, there may be panic, but if you have a broken bone, as you're saying, if you have some sort of issue with a ligament in your knee, and maybe people are spending more time outdoors, which could be a really great thing during this time, and so they're showing up in your business, and that's keeping your business alive, and you're finding ways to facilitate that without endangering those people. That's just an amazing success story to hear. It's that kind of stuff that I would say we look for and say, how can these be adapted, and maybe perhaps with technology offered in other areas, the sort of lessons learned, and in a way such that if in 2 years you were like, well, this is a big mistake, but that's been propagated really quickly via tech, that we were able to go in and have that neurally sort of alerted to the people downstream that, oh, wait, there was another deeper lesson that was learned. So, that's there too. And I think that's really where tech can make a difference in the messaging today, is working towards products that are available to any industry, wherein that information, when it's put out, isn't just put out as a PR release of some sort. This sort of like I dropped it out there and I've moved on with my life. So I really feel when you're talking about what does it look like in my space, what that looks like is a lot of these kinds of conversations of understanding what is working for people. What are the challenges that they're facing? If it is in messaging, what solutions have they tried? And if they're looking at AI, in what explainable manner and verifiable manner over time can we bring them into that in a space that's organic, not like, hey, let's just drop something in because there's a crisis. This is the thing that I think's really happened out of this, is we're talking about credibility, right? It's a general thing. But if you have a circumstance where when you're scrambling to deal with a problem and all of a sudden that becomes the sort of engine for new problems, I got to find something, and then you go slap something on there. It's like you put something prematurely into place. If you make some modification to someone's bone structure, and all of a sudden they've got a shorter leg for a period of time because you had something occurring that was causing, hey, we got to try this new therapy or something, they might have been better off waiting for that surgery for a period of time. I mean, these sorts of things, they require calmness in a space in which everyone might be panicking. You sit there and you say, okay, we have valuable tools. We have confidence in that humanity has migrated across all kinds of geographical regions, through all kinds of historical plagues and pandemics. And what would it look like for us to make sure that we take proper care to provide solutions that really do give people a warning, that do allow us to mitigate some of these things by, what is our messaging? What does it look like for us to maintain credibility with the CDC? For them to have an opportunity to retract that. They're busy talking about contact tracing, for example, which is about an individual, right? But what about their aspect of diving into tracing of their action, right? How did it happen? How do we make sure that isn't happening again? And how do we restore credibility? Because these organizations have immense credibility, and that credibility is really important to create a state of calmness when people are panicking. And that really gives us access to come in and deliberately say, here's a tool, it's worked like this. We've spoken with people that have this issue in these various industries. This didn't just happen to be something that worked well in a startup land, or this happened to work well because it was backed by billions of dollars in funding and there was some underlying reason for that to continue to be present. It's there because people actually visited the underlying issue, what philosophically failed, what are the tools we have access to, and how can we make that something that builds credibility over time, something people can visit when there's a concern, and not that just somebody who consumed that message could visit, but that the person who authored that message, a person who derived another message off of it and cited yours, can go have access to platforms that propagate that instead of propagating something because it was popular. I mean, this was the struggle with tech, right? We visited the Cambridge Analytica scandal, and we have these problems with social media where it's like, yeah, it was great because it was popular and it zoomed up and everyone's like, yeah, give me more likes, give me more follows. I love it. I can post pictures of my cat and I feel great. I get a positive feedback, right? These things were there with tech, but they weren't trending by merit. It wasn't based on, and I think this is especially important in a field like medicine and in fields like tech. We have the capacity with machines to be able to compile things. We can validate them using roles. We can go in and take it as long as it has some sort of validatable structure. AI as a space has some areas that are roles-based, some areas that are sort of trained. You could call it, you're feeding specific kinds of data. You've kind of given the machine some idea of what that data is supposed to be or what kind of outcomes they're supposed to have. These are different ways of attacking problems. I think my take on artificial intelligence, if it could be rolled up into a nutshell, is that it should be a human first based approach. And I say that because you can't give a machine humanity. And you can have a circumstance where people can evolve and they're in their space of being freer by being able to rely on things that can be validated by human beings, that can be validated by machines because people aren't so good at remembering why they came to a conclusion. If I come to a conclusion about something and I say it today, I might be really set on it because I spent a bunch of time in university on a thesis, and then I published that thesis, and now any new information that comes at me for years on end, any conversation that I engage in, I'm probably going to win, right? And I might surround myself with people who also agree with that. And I feel that this is really, really important because as an aspect, as human beings, as doctors who have to know a bunch of things, they have to memorize a tremendous amount of information to be able to recognize a pattern that they're seeing intuitively, oftentimes with a very short period of time to do so between patients. This aspect of being able to have access to letting go of memorizing all that or keeping all that in your brain is, can I have something that does the hierarchical part of it? Because I can be confident about a conclusion because I spent a lot of time on figuring out all the hierarchy that led to that conclusion. But as a human being, I do not have memory capability to go back and keep those links and keep them, first of all, they're in my head at that point, which means unless I published a paper on it and cited a bunch of things, no one can follow the trace of it. So we're talking about chain of custody and traceability. That all requires you to take it outside your head. And when you're really, you're working with a patient and so forth, that information, that research and so forth is changing very, very quickly. And so what you want is a network of information. You really want a wiki that you have access to, where you're mainly focused on the top level stuff. You're not having to worry all the time about the elemental things or how it got there, but you know anybody can look at it. And further, you know that added to that is a machine that's assisting you because someone changed it on the basis, right? Something 4 or 5 or 6 degrees away from what it is that you've relied on for a period of time. And you can determine whether or not you respect that person's change, right? So these sorts of things, we're talking about a way in which you have a knowledge base that's responsive to changes and also simultaneously validatable. And I think the first step to that in the messaging space that you're referring to is to talk about a case, bring case studies in, and say, what does it look like to have traceability in that?
Matthew, you're obviously a very kind of philosophical thinker about how we acquire knowledge and disseminate it to other people. So that's really great. We're probably about to the part where we're almost ready to kind of go into breakout room sessions here on the Zoom link. And so I think we're going to post that pretty quickly. But to summarize for a transition, if you had to give physician entrepreneurs or other people, innovators inside of the healthcare space, kind of a takeaway as far as how to focus on messaging credibility by leveraging technology, where would you tell them to turn, even for a kind of a basic approach forward?
Well, I think the first thing I would say is don't look near term. I mean, this is going to go away. We are going to deal with this problem as a community, right? Making a bunch of short-term decisions about that may be about survivability. If you're a small business owner, if you're concerned about getting messaging out, there are lots of tools to do that. I think the quick thing for the breakout would be, what does it look like to be credible for you? I mean, in your space, because there's oftentimes a lot where we just rely on that because we have a title or because we worked at a particular company. If someone works at Google or Apple or Facebook, and there's automatically something ascribed to that. But what would it look like for people to be able to build that individually, such that when they're walking around, the credibility that they have is because of what you can trace back about what they said about that. And this is my take on it. So to really hear, what are the things people are struggling with in maybe practical terms, because we've spent time talking about some of the philosophy behind that. In practical terms, what is it that people are seeing with the messaging? Are there cases where patients are coming in and saying like, yeah, I heard this and it came from the organization you're affiliated with, and I feel this way about it. So I invite whatever questions come, and also I'm happy to share if I don't know anything about that. So I appreciate the time we've been able to talk about some of the philosophy, because I think the philosophy to me is at the heart of each one of these matters. If we can't get basics right about why we're doing something for our community, I think there's a real danger talking about tech being harmful, and really the person behind that being harmful is jumping too quickly to applying solutions in those spaces. Can be catastrophic, and that can cost people in their privacy. It can cost people in their health. It can cost people in their confidence within their society itself. And so, you're going to see me measured, and you're going to see me talking a lot about philosophy in probably any one of the spaces that I go into, because I love the practicality of being able to jump in and do something cool with tech and see it really work. But I like to see that it will sustainably work with the communities that it's applied to.
Thank you so much, Matthew. We appreciate you being here on the broadcast session, and we'll see you shortly in the breakout room.
Sounds good.